welcome to my video assessment. Today we'll be doing a cardiovascular exam. We have a scenario which is about a 24-year-old female who has had a syncopal episode. We're going to use the mannequin here and my colleague's going to film and answer the questions for the mannequin. So let's begin. So set of precautions, gloves and goggles, looking for any dangers. Can't see, smell, hear any dangers. Safe to approach the scene. Knock knock. Hello, it's the ambulance.
Hi, welcome.
Hello. Before we come in, just want to know, are you meant to be in isolation or quarantine?
No, nothing like that.
No, and you don't have any COVID symptoms?
No COVID symptoms.
No, not waiting for any COVID test results?
No.
Great. All right. Hello, I'm Zafira. What's your name?
Hi, I'm Sarah.
Sarah. Nice to meet you, Sarah. So I'm just going to do a few checks on you, okay? And we'll have a little chat.
Okay.
So what's happened this morning?
I was just sort of sitting on the couch and I felt a bit dizzy and I don't really remember what happened after that.
Okay. How long ago did that happen?
About half an hour ago.
Okay. And when you did that, were you just sitting on the couch?
Yeah, I have been for a run, but I was just sitting on the couch when this happened.
Okay, no problem. And so you felt a bit dizzy as well.
Yep.
How long did that last?
I'm not really sure. It's a bit of a blur.
Yeah. Do you remember everything or not really?
I remember feeling dizzy, but I don't remember what happened after that.
Okay, so you think you might have blacked out for a bit there?
Yeah, possibly.
Okay, no problem. And do you have any other symptoms with that?
I was a little bit sweaty at the time.
Yeah, okay. Did you feel like your heart was beating out of your chest or?
Yeah, I did have a bit of chest pain now you mentioned that, yeah.
Yeah. Alright. So we'll just get these vitals done. Do you have any medical conditions at all?
No medical history.
No. Do you take any regular medications?
No, I haven't taken any medications ever, really. Yeah.
No, alright. And are you allergic to anything?
No, I'm not allergic to anything.
No. And what about your family? Does your family have any cardiac history at all?
Yeah, my granddad did die a couple of years ago. They said it was a heart attack.
Oh, okay. Sorry to hear that. What about your grandma?
Yeah, my grandma, she has something wrong with the heart.
Yeah, okay.
It's a funny rhythm, they said, or she says.
Okay, yeah, like atrial fibrillation?
That's the one, that sounds familiar.
Yeah, okay. What about your siblings or your parents? Are they still alive?
They're still alive.
Cool. Alright. And what about socially? What do you do?
Oh, I work full time.
Yeah, okay. How's that going? That's alright?
Yeah, a little bit of stress, but otherwise that's all good.
Yeah, okay. Are you a smoker at all?
Yeah, I do have the occasional cigarette.
Alright, and what about alcohol?
Like everyone else, I have the occasional drink on a day off.
Yeah, okay, no problem. Alright. Just going to put a few more dots on you.
Yep.
Do you still have that chest pain?
Oh, it's a bit of a niggle.
Okay. Whereabouts is it? If you can
Oh.
point to it.
Sort of right in the middle of my chest,
Yeah,
maybe.
so just around here?
Yeah, and a little bit to the left, maybe.
Okay. Does it go anywhere else?
Nah, just in the middle and to the left.
Okay, yeah. And how bad's that pain out of 10? If 10's like getting your arm chopped off?
It's more just a niggle.
Okay, so it's not too bad then?
No, like it's not hurting, it's a niggle.
Yeah.
I know something's, it's not normal, but it's not hurting.
Yeah, okay. And does it go anywhere else?
No, just there.
Just there, okay. Do you still feel dizzy at all?
It's not so bad when I'm sitting down like this, but if I stood up, maybe I would do.
Yeah, okay. Alright, so we've got you all hooked up now. Everything's looking normal for your vitals, so that's good.
No, that's good, thank you.
Yeah, so now what we're going to do is I'm going to do a cardiovascular exam, okay? Your symptoms sound kind of cardiac, but you don't have any cardiac history, so is that okay with you?
Yeah, you do what you need to do.
Okay, cool. So to start the cardiovascular exam, I'm just going to have a general inspection, just looking for any cyanosis, shortness of breath, just looking at the patient's pallor, seeing if they look distressed at all. So the patient seems comfortable now, maybe a little bit pale, doesn't appear to be short of breath. So now, could I please have a look at your hands?
Absolutely.
Sarah?
Here they are.
Alright, so just going to have a look at your hands. And I'm just looking for any finger clubbing. So if I can get you to do this and make a little window with your index fingers.
A little window, just like this?
Yeah, so patient does that, no signs of finger clubbing there. I'm just having a look for any peripheral cyanosis. Also just looking for any tobacco staining, splinter hemorrhage, Janeway lesions, Osler nodes, and just going to test for a cap refill. So can't see any signs of any of those things, which is good. Now I'm just going to do a radial pulse. So just going to feel your pulse here, Sarah. And just time that for 10 seconds and then times it by 6. Cool, so heart rate of about 70, nice and strong pulse there, feels regular. Now I'm just going to have a feel of your other radial and feel for a radial delay. Okay, can't feel any delays there. I'm going to have a feel of your brachial pulse as well. Just feeling its character, if it's strong, thready. Okay, that also feels normal. I'm just going to gently press on your neck, Sarah. So feeling for a carotid here. And on the other side. Okay, and now we're going to feel your femoral pulse. So I'm just going to feel sort of just down below here, okay, Sarah? Is that okay?
Yep.
Yeah, great. So feeling for femoral here. And then for a radial femoral delay. Okay. Now we're going to check for a collapsing pulse. So, do you have any pain in your shoulder, Sarah?
No pain in the shoulders.
No? Okay, so just feeling your radial pulse here. We're going to lift your arm up for a few seconds. Okay, and then I'm going to feel this one here and drop it back down. Okay. So we've done a blood pressure on this arm. Also going to do a blood pressure on the other arm, Sarah, just to see if there's any difference, okay?
That's fine, yep.
Alright, so doing a blood pressure there on that arm. Okay, so Sarah, now I'm going to assess for a JVP. So can you please turn your head to the left slightly? Okay. So turning the head about 45 degrees, looking from the right side, and we're just looking for the top of the pulsation from above the sternal angle. And do you have any pain in your tummy?
No pain in the tummy.
No, okay, so I'm just going to press here for the abdominal reflex check. Okay, cool, and that's assessing the JVP. I'm just going to have a look at your eyes. So we're checking for xanthelasma, we're looking at any corneal arcus that might be there, and just checking the conjunctival pallor. Okay. And can you open your mouth, Sarah? Cool. So we're just looking for cyanosis and dental hygiene. Now we're going to inspect the chest. So we're just looking for any scars that might indicate the patient's had surgery, any chest deformity, any visible pulsations. We're also going to feel for an apex beat in the 5th intercostal space mid-clavicular line. So we have a feel. And then mid-clavicular. So just having a feel of that apex beat. Okay. And we're going to feel for heaves with the heel of our hand, and feel for thrills. Okay. So now I'm going to auscultate the heart sounds, listening for S1 and S2, making note of any additional sounds or heart murmurs that may be present. And we're going to use the bell of the stethoscope for the lower frequencies. Okay, and now we're going to use the diaphragm of the stethoscope to auscultate those sounds again. Okay. And just going to also auscultate the carotids to listen for any bruits that may be present. Okay. And now going to listen to the left side for pansystolic murmur. Okay, and now listening for mitral stenosis at the apex by asking my patient to lean on their left side. So Sarah, can you lean on your left side? I'm going to have another listen to your heart. So she's going to lean on her left. Okay, nice. Sarah, can you sit forward for me, please? So I'm going to inspect the posterior chest. She wants to sit up for me. There we go. All right, and while she's sitting up, auscultate the lungs and listening for any pulmonary edema. And just also having a feel for any sacral edema. Okay, you can sit back now, Sarah. So now we're going to have a look at the abdomen and have a feel for any pulsating masses that might indicate an aortic aneurysm. So just having a feel. And going to have a look at the legs for any pitting edema. Okay, so that's the cardiovascular exam done. So Sarah, all your findings from your cardiovascular exam is normal. Didn't find any abnormalities on your face. There was no evidence of hyperlipidemia from xanthelasmas. There's no evidence of cyanosis. No evidence of hypoxia through finger clubbing. Your chest is all clear. There's no scars, no deformities, no pulsating masses in the abdomen that I could feel. No sacral edema or pitting edema. Heart sounds are all normal, no murmurs or extra heart sounds, and lungs sound clear. So today, Sarah, you've got some chest pain, just mild chest pain, and you've had a syncopal episode by the sounds of it. You had a little faint, so we recommend that you take a trip to hospital with us so that they can do some blood tests and some scans to make sure that everything is normal with your heart. For your chest pain, we're going to give you an aspirin. Your blood pressure is on the lower side, so we'll hold off on the GTN. And then if your pain's still not good, we'll pop a little needle in and can give you something through there for the pain, okay?
All right, thank you.
That sounds like a good idea. All right. Well, we'll sort out extrication and take you to the hospital. Thank you, Sarah.
Thank you.
Well done.